And you wonder why I laugh to keep from crying sometimes. Come on in here, family. Come on in, neighbors. Tonight we need to talk about something that's going to be affecting millions of households across the country, including our seniors, our parents, aunties, uncles, and even the caregivers holding things together behind the scenes. Excuse me, here's what you need to know. UnitedHealthcare, the largest Medicare Advantage insurer in the nation, has announced that in 2026, they expect 1 million seniors to be dropped from their Medicare Advantage plans. Not 1,000, not 100,000. You heard what I said. 1 million. And that is the biggest shift we've seen in senior healthcare in over a decade. So let's break down what's happening and what you need to do right now. Well, why is this happening, Paulette? What's going on? Well, according to financial filings and industry reports, healthcare costs are rising. Seniors are using more services than expected. Hmm. Medicare reimbursements are tightening, and insurers are saying some plans in some counties are no longer, pause, profitable. Now, that's according to Reuters and the Star Tribune. Okay? So, United Healthcare is pulling out of over 100 counties and restructuring the plans they still offer. What this means is some seniors are going to be automatically removed from their current plan. Some are going to find their doctors no longer are in the network. Some are going to see higher premiums, fewer benefits, or reduced prescription coverage, all the things. This is not fear mongering, folks, because people think that's what I do when I come on here is I fear monger for clicks and likes. No, this is the reality documented in the company's own financial statements. And what seniors need to do starting now, not tomorrow, starting now, listen carefully, neighbors, this part is important. If you or someone you love is on a Medicare Advantage plan with United Healthcare, do not wait until the enrollment deadline. Here's what you need to do. After I did some research, is read your plan letter. United Healthcare is sending out notices. So if your letter says plan will not be offered in 2026, or network change, or benefit reduction, or you must select a new plan, take action immediately. 2, call your doctor and ask them this question. Will you be still accepting my plan next year? Doctors and hospitals often know before you do. 3, compare your options. You may need to switch to a different Medicare Advantage plan or to original Medicare plus a Medigap plan plus a Part D drug plan. So just remember there's no one size fits all answer. Every senior situation is different. And 4, check your medications. See, this is where many people get caught off guard. Plans can drop or re-tier medications, meaning here's what's going to happen. What was $5 last year, which is in my case could jump to 50 or 200, which actually happened to me. And I'm not on a Medicare Advantage plan. Get help if you need it. And this is where community steps in. How local helpers and community leaders can step in is this way. What you need to be able to do is to help the elderly in your community understand. So if you're a caregiver, a church, a wellness leader, a social worker, a community worker, organizer, or simply just the reliable tech-savvy family member, you can help with a couple of ways. Help them to understand their host plan comparison sessions. Get them to one. Even 1 hour can change a senior's entire year. Walk seniors through the letters that they get, because a lot of times they don't understand, or it's online. A lot of notices are written in complicated language. So sit with them. Highlight the important lines. Help them to call Medicare or SHIP. That's the State Healthcare Insurance Assistance Programs. And they're free, unbiased, and available in every state, right? Check on your seniors who live alone, because they may not be doing their due diligence and they may miss out on those likely notices that are coming, okay? Share verified information, folks, because the worst thing we can do is let confusion create panic, okay? That's the big deal. Family healthcare is complicated, but we don't have to face it alone. United Healthcare's decision is absolutely going to affect nearly 1 million seniors. But with information, with preparation, with support, we can help elders navigate what's coming. Don't leave them out there in the dark. See, that's the thing. And to stay protected. So, I'm going to stay on this story, right? Because I'm actually at that age and I don't know what I should be receiving in the news pretty soon. But what I want you to do is to continue to stay connected to Brownstone Worldwide, Cityscape Radio, and you guessed it, Brownstone Living Magazine for more news and information throughout your day. I'll be back before we wrap for the evening for your evening late night news. We'll see you around.